What does the N in nice stand for? It stands for notice. What can you notice about someone? We like to say, notice what is right and what is good about someone, so you can notice when something is different about the way that person is thinking, acting, or feeling. It's not unusual for someone to have a bad day or even a bad week. But you're starting to think it's more than that. If you notice changes in someone's behavior or personality that last longer than 2 weeks, it's time to be concerned. We realize that most of you probably aren't trained professionals, but anyone can notice changes on how someone thinks, acts, and feels. It's as simple as that. That's your mental health. Did they suddenly quit something they used to love, or they're avoiding their friends and family? They're suddenly using drugs and alcohol, or they're crying all the time and they're not sure why? They're shrugging responsibilities, or they can't sleep, or they sleep constantly. Have you noticed they've stopped taking care of themselves? They don't have a lot of energy. They're overeating, or maybe they're not eating at all, causing their weight to flux. They have headaches constantly, or they have unexplained aches and pains. Is the person acting out or quick to anger? Are they so sad? Or maybe they don't feel anything at all. They're criticizing themselves all the time and they feel lonely. Or worse, they have thoughts of death or suicide. It's okay to be struggling with your mental health. In fact, mental illnesses affect 1 in 5 people. That's 20% of the population. Remember, these are feelings we can all relate to, but these are changes you've noticed for 2 weeks or longer that are affecting how someone thinks, acts, and feels. Here are the basics. Notice how people are being treated and treating others. What is right, good, or different about that person. That way you can notice when they have a change in behavior or personality. The person you're concerned about is in middle or high school. You think maybe it's just mood swings or teenage angst, but you should know that half of all mental disorders begin by age 14 and 3/4 of them begin by age 24. Like any illness, noticing symptoms along with an early diagnosis will result in a quicker recovery. We realize this can be scary stuff. We want you to keep yourself and someone who is struggling safe by learning the next steps in the Be Nice Action Plan. Now we know the N in NICE stands for notice, but what does the I stand for? It stands for invite. Invite yourself to start a conversation. Invite involves taking a risk and reaching out, and this can be an intimidating situation, but we're going to give you the tools you need to be confident in your approach. You've noticed a change in how someone thinks, acts, or feels, and it's been going on for 2 weeks or longer. Now is the time to start that conversation. Show them that you're concerned and you care. A great way to start the conversation is, "Can we talk? I've noticed this, and I'm really worried about you." Make sure you use an example that you've noticed personally, and then invite yourself to listen non-judgmentally. Suicide is the second leading cause of death among high school students. It's the 10th leading cause of death among adults. Starting a conversation is a simple act that can save a life. You've started the conversation, and now it's time to be a good listener. Be patient. This stuff isn't easy to talk about. And make sure you don't make promises that you can't keep. Are you using positive body language so that they feel comfortable sharing? You may not know what it feels like to be depressed or anxious, and that's okay. Just be understanding and be an active listener. And be honest. It's okay to say, "I don't know all the answers, but let's figure them out together." Helping an individual is great, and we can take it to the next level by inviting ourselves to make a change in our school, workplace, or community to create a healthier environment for those struggling with their mental health. Start by noticing what your school or workplace is missing when it comes to mental health. How can you bring about awareness? Are there already programs or professionals in place to help you? Invite yourself to be aware of your surroundings. You've noticed a change in someone lasting 2 weeks or longer. Start that conversation and be a good listener because you might be the first one this person is opening up to. Take initiative to create a healthier environment for yourself and your peers. You're ready to invite yourself to start a conversation or make a change. So what's next? Learn what the C means in the Be Nice action plan. Now we know how to notice and how to invite. So what does the C in NICE stand for? It stands for challenge. You can challenge the stigma. There are 3 ways that you can challenge. Challenge the individual or yourself to seek help. Challenge yourself to ask the question. Challenge the stigma. Lead by example. Let's get help. Start with someone you trust. This could be a parent, coworker, coach, counselor, sibling, or on-staff social worker. If you're a young person, it's good to have an adult on your side who can help you find professional and appropriate care. You're never too young or too old to seek treatment. 79% of children with a mental health issue go untreated, and 45% of adults never receive treatment. That means nearly 50% struggle when they could get help. The type of professional you'll see will depend on your mental health illness. It could be a doctor or primary care physician, a psychiatrist, a social worker, or a certified peer specialist. These professionals may prescribe you talk therapies, medication, or a self-help plan. Notice, the same treatment doesn't work for everyone, so it may take you a few tries to figure out which works best. The sooner you can get help, the better. An early diagnosis and treatment results in accelerated recovery. This protects the brain from further damage related to the course of mental illness. If you hear someone say something like, "The world would be better off without me. I wish I was dead. Everyone would be happier if I wasn't around," you need to take these comments seriously. It's not just a cry for attention. These could be serious thoughts. Don't miss the opportunity to save a life. It's hard, but ask them, "Are you thinking of killing yourself?" And tell them that there is hope and there is help. More than 90% of children who die by suicide have a mental health condition, and 90% of all people have risk factors or show warning signs before dying this way. The number one reason people don't seek treatment is because they're worried about what other people will think or say. Your voice and actions can create mental health awareness, and by talking openly, you're reducing stigma. Tell that person there's nothing to be ashamed of. Depression can be a lonely journey, so stick by their side. If someone had a broken arm, you wouldn't tell them to get over it. Someone with depression can't just be happy. Think before you say something that could increase stigma. You've noticed a change and invited yourself to start a conversation, and now you're ready to challenge an individual or yourself to seek help. Ask the tough questions and challenge the stigma. Talk openly about mental health. All right, we made it through challenge, and now you're ready to challenge the stigma and ask the hard questions that could save a life. So what's next? Learn the final step of the Be Nice action plan. You've made it to the last step in the Be Nice action plan. So what does the E stand for? It stands for empower. Is there a better feeling than empowering yourself or others? Empower has 2 definitions. Give someone the authority or power to do something, or make someone stronger and more confident, especially in controlling their life and claiming their rights. Empower yourself with the knowledge that you can have an effect on how someone thinks, acts, and feels. Empower yourself and others by finding protective factors. Utilize available services. Get involved at work or at school. Embrace supportive friends and family members. Be self-aware and have strong morals. Surround yourself with positive role models. Deepen your faith. Have a positive attitude. Maintain good boundaries. Discover problem-solving skills and identify coping skills. Good coping skills include hobbies like practicing your favorite sport, perfecting a recipe, losing yourself to music, slowing down to get some fresh air, or expressing your thoughts and feelings by writing about your day. Create a list of go-to resources. This is a 24/7 suicide prevention hotline. Are there hospitals or local therapists in your area? Who are social workers or counselors in your school or workplace? Still not sure where to start? Let us help. Click the Get Help tab on our website. You'll find local services and professionals, a mental health screening tool, and links to information about mental health. Empower yourself by implementing the Be Nice action plan into your daily life. Now you know what it means to notice, invite, challenge, and empower. You know what it means to be nice. Take the pledge to be a mental health awareness advocate in your community.